In the medical industry, there are many disciplines. They all share the goal of improving, saving, or changing lives. Join us as we meet the people, discover the technology, and explore the organizations of this vital industry. Healthcare is one of today's most dynamic and growing fields. Let's take a look inside this vital industry.
1 out of every 4 people will, at some point in their life, experience diagnosable symptoms of mental illness. In nearly 70% of cases, the onset of mental illness happens before age 14. Early identification, intervention, and access to care are critical to helping those in need. The U.S., however, faces a significant shortage of board-certified child psychiatrists. There are nearly 7,000 in the U.S., and not all of them are actively practicing. It's estimated that upwards of 30,000 board-certified psychiatrists are called for to only begin to meet the needs of our nation's youth population. This shortage is amplified by the fact that many healthcare systems have reduced or eliminated certain psychiatric services. Families are left waiting for help, enabling conditions to spiral into unnecessary crisis. Founded in 2009 by child psychiatrist and researcher Dr. Steven Setterberg, PrairieCare and PrairieCare Medical Group provides specialized psychiatric services to children, teens, and adults in the Twin Cities region.
PrairieCare's vision as an organization is really to transform psychiatric healthcare in 2 main ways. First, just simply to increase access to psychiatric care. We expect good access in all areas of medicine, but it's often not there in psychiatry, and that's the focus of our expansion. Secondly, in terms of standards of excellence, again, bringing psychiatry to that level of scientific precision and evidence-based work that we get in all of medicine.
Experts say most psychiatric conditions are highly treatable, especially when identified early.
So just like with physical illness, mental illness presents along an entire continuum from quite severe, requiring aggressive intervention, to less severe that might respond quite well to routine outpatient care. So as we know, early intervention can prevent mental illness from progressing to more severe states.
PrairieCare is Minnesota's only privately run psychiatric healthcare system, and one of just a few in the nation. It has grown by nearly 35% each year since 2010, and today employs an expansive staff of highly skilled clinicians.
There's a stigma surrounding mental illness that has created barriers for people to receive treatment, whether it's even talking about it or seeking services. PrairieCare is trying to reshape the way services are delivered and increase access to care, so it's no longer an issue. Our treatment environment is very warm and friendly and really conducive to receiving care, which optimizes patient experience and outcomes.
PrairieCare provides specialized psychiatric services for all ages throughout a continuum of care. PrairieCare's youth services span outpatient, partial hospital, and inpatient hospital programs. The organization is also pioneering the movement to bridge the gap between traditional psychiatric services and medical services by integrating behavioral health directly into the primary care setting.
One of the more exciting things we're doing here at PrairieCare is really trying to innovate ways in which we can provide mental health services to patients in primary care settings. We're trying to accomplish this through the use of remote access clinics and televideo technologies.
All of PrairieCare's programs incorporate complementary therapies such as mindfulness, recreation therapy, yoga, art therapy, and occupational therapy. Therapists work with patients both in groups and individually. Parent involvement in the youth therapy process is crucial to helping their child heal and build resiliency as a family.
We have a very active partnership with one of the local school districts. They provide teachers that come right into our programs and give the kids 2 hours a day of schooling along with their treatment so the kids are ready to go back to school and reintegrate when they're done with the treatment.
Clinicians at PrairieCare track daily progress related to each patient's treatment goals. Most patients are highly successful and able to lead happy and healthy lives.
Our affiliation with the University of Minnesota Medical School sets the stage for an academic environment where we have an influence. But our main focus of innovation is on trying to figure out how to balance the sophisticated neuroscientific perspectives we have on the one hand with the humanistic, compassionate elements that patients require on the other.